Hello everyone, my name is Joshua Kiva from St. Augustine School of Nursing, Iloilo Branch. In this video, I would like to show you how to demonstrate a children's vital signs. Vital signs is including heart rate, respiration, or breathing rate, blood pressures, and temperature. Knowing the range of vital signs for your child can help you notice problems early or relieve concerns you may have about how your children is doing. Today I will need to do is the heart rate. To check your pulse at your wrist, place the two fingers between bone and bend over your radial artery, which is located for the top side of your wrist when you feel your pulse. Count the number of the beat in seconds. Then multiply this number by 4 to calculate your beats per minute. If it's hard to feel the pulse in your wrist, find the artery in your neck that it's just to either side of the wrist part. For the child from 1 to 11 years old must be 70 to 120 at the normal rate blood pressure. And for the preteens and teens, 60 to 100 the normal rate. The second is for the respiration rate. It's the number of the breath a person takes per minute. The rate is usually measured when a person is at rest at simple inputs, counting the number of breaths from 1 minute by counting how many times the chest breathes. It's the best to take your respiratory rate while sitting up in a chair or in a bed. Measure your breathing rate by counting the number of the times your chest or abdomen rising over the course of 1 minute. For 1 to 5 years old must be 20 to 30 the normal rate, and for the 6 to 11 years old is 12 to 20 BPM rate. The third one is the blood pressure. The blood pressure the material that we needed is the stethoscope, manual blood pressure cuff, alcohol, cotton ball. Before we start our echo for blood pressure, we need to do a hand washing procedure or to prevent infections and microorganisms. Then we have the patient sit down for 3 to 5 minutes and legs not crossed and arms at their level. Then have the exact cup for the patient and ask the patient which arm is prepared. Location the pulse by lightly pressing your index and the middle finger slightly to the inside of the bend of the elbow where the brachial area is located. Secure the cup. Secure the cuff and take your stethoscope, put under the cuff. Make sure you hear that artery. Then, inflate the cow to 90 to 55 millimeters or 100 to 110 to 75 mm of mercury. Take a rubber band, start to leaping out of the air slowly and very slowly. And when you see the needle down from 2 to 3 millimeter of mercury, the first one to hear but that is systolic. And until you hear the second one, and that is diastolic. Last one is the temperature. We have four ways to take a temperature. The first one is rectal, ear, oral, and axillary. Uh, how to take a temperature in axillary or armpit? The material that we needed is digital thermometers, cotton balls, and alcohol. For each temperatures, for rectal is 36.66 degrees or 97.9 Fahrenheit. And for the air temperature is the normal is 35.8 degrees Celsius or 96.4 Fahrenheit. For the oral temperatures, the 35.8 degrees Celsius or 96.4 Fahrenheit. For auxiliary temperature is 36.5 degrees Celsius or 97.8 Fahrenheit. Before we start, do the hand washing procedures or sanitizing to prevent the microorganisms. Then, clean the sensors or thermometer using the cotton balls with the alcohol. Then, turn on the digital thermometer. Wait until you hear the sound and the display windows for 0. Then, put the digital thermometer under the armpit or any of those 4 of those procedures. Put the digital wait until you hear the sound and take out. That's the way you can check the thermometer of the patient. Thank you for watching my demo.